Is that more contagious coronavirus variant first found in the UK also more likely to kill you if you catch it?
I'm pretty convinced that there is a degree of increase in seriousness of the actual infection, which we really have to keep an eye on.
Good afternoon.
Today, President Biden, hoping to slow the spread of that and other variants, reinstated travel restrictions for non-US citizens coming from much of Europe and Brazil, also adding South Africa.
The vaccines that we have now do work
against these variants, although Moderna now says its vaccine works, but not quite as well against the South Africa strain. They'll test if a third dose or a variant booster might help. For now, in the raw numbers, there is some optimism. First time since mid-December, fewer than 115,000 Americans in the hospital with this virus. These past 2 weeks, average daily case counts have fallen 30%. But the country still adding more than 1 million infections a week. On average, more than 3,000 deaths still reported every day. And
if the variant that has greater degree of transmissibility becomes dominant, we're going to be faced with another challenge.
And 6 weeks since the first vaccine shot, only around 1% of the population double-dosed. Team Biden says hamstrung by a Team Trump hangover.
Is there at least a ballpark amount that officials are aware of how much vaccine there is?
Well, our team is working right now. We've been here for 5 days to evaluate the supply. So the confusion around this issue, which we acknowledge there is some confusion, is speaks to a larger problem, which is what we're inheriting from the prior administration, which is much worse than we could have imagined.
There are more disturbing insights now into how hard it was to fight a pandemic and save lives when Donald Trump was in charge.
I saw the president presenting graphs that I never made. So I know that someone out there or someone inside was creating a parallel set of data.
There was a considerable amount of mixed messaging about what needed to be done from the top down. And that really cost us dearly.
Well, here in California, the stay-home orders have been lifted now across the state. Tens of millions of Californians can again get their hair cut and eat at least outside a restaurant. But they say the darkest hour comes before the dawn. January is looking like it will be the deadliest month of this entire pandemic here in the United States. Nick Watt, CNN, Los Angeles.
Ashish Jha is Dean of Public Health at Brown University. He joins you now from Newton, Massachusetts. So, Dr. Jha, thank you for being with us.
Thank you for having me on.
Okay, well, the variant of the moment, known as B1351, first detected in South Africa. Drug maker Moderna is now reporting that lab tests found that there was a 6-fold reduction in their vaccine's neutralizing power against B1351 than against earlier forms of the coronavirus. 6-fold sounds like a lot. So what does that actually mean?
Yeah, it's a great question, John. And basically, at this point, based on everything we've seen, I still believe that the Moderna vaccine is going to be effective against this variant, but it may be a little bit less so. So right now, the vaccine is generating incredibly high levels of antibodies, and that's why you get the 95+% protection against this virus. It may be that the level of protection may be a little bit less with this variant.
Okay, so when the first significant mutation was reported in the UK, the official word was this variant, it's a lot more contagious, not more deadly. That assessment is changing, it seems. Here's Dr. Anthony Fauci. Listen to this.
When they looked at it, it did not look like on a case-by-case basis that it was actually more virulent, is the word they use, namely more likely to make you seriously ill or kill you. When they went and became more granular and looked at the data, they became convinced that it is, in fact, a bit more virulent, namely making it more difficult when you get to the point of serious disease and even death. So I believe their data. I haven't seen all of it, but from what I've heard, I believe the data.
So it's slightly higher in terms of mortality. Vaccines may be slightly less effective. Do two slightlys add up to be a significant problem?
Yeah, look, first and foremost, these variants are not great. They're not good news, and we want to try to prevent more of them. The UK variant does look like it's a bit more deadly. It's a lot more contagious. For that one, the Moderna vaccine and the Pfizer vaccine are quite effective. There's no question in my mind that they're going to be effective against that. It's the South Africa variant where we're starting to worry about how effective is the vaccine going to be. Again, I remain reasonably confident it will be. But all of this suggests that we have some challenges ahead of us we've got to deal with. And we've really got to get these vaccines out as quickly as possible before more variants come online.
Yeah, Moderna is now working on a vaccine for that variant, which was found in South Africa. Here's the president of that drug-making company, Stephen Hogue. Here he is.
The virus is evolving. It's not sitting still. It didn't start in a human host, and it's still figuring out its best way through the human population.
Yeah, that really sounds like there's a lot worse still to come. And if we had vaccinated a lot faster, if we got people immunised quicker, would we be seeing these variants right now?
Yeah, so, variants arise basically because we keep giving the virus a lot more chances. Every time the virus spreads to more people, you get more variants and more opportunities for mutations to become significant. If we had been able to really stomp out this pandemic much earlier, if we had gotten vaccines out earlier, I think you would see a lot fewer variants than we're seeing right now. Our playbook is still the same. Get people vaccinated, bring the pandemic under control, and then make updates to vaccines as we need to.
And if we had implemented social distancing and hand washing and implemented lockdowns on a much more significant, effective basis, that was the other way of stopping this pandemic, right? Because that did not prove effective because of our own behaviour. That's allowed this virus to flourish and mutate.
Yeah, absolutely. So you can look at places like New Zealand and Australia that have had relatively few cases without having a vaccine. And they've used what are called non-pharmaceutical interventions, the stuff you talk about, the public health measures. We could have done that as well. And we haven't done that in the US and in much of Western Europe for a variety of reasons. But I think a lack of political leadership has certainly been part of that.
When the variants were first detected in the UK, many public health officials and others warned, it was more contagious, but not more deadly. And then they would add, as far as we know, or the available data suggests. It seems there's a lot more emphasis on the no more deadly part of that message compared to the we really don't know for certain. Given how this virus is mutating and the dangers it presents, perhaps, the emphasis should be more about the unknowns at this point.
Yeah, absolutely. I mean, this has been one of the challenges in the pandemic is obviously this is unlike any health crisis we've dealt with. And there are twists and turns that are not predictable. And I think one of the things that we have to do a better job in public health is communicating to people that there is a lot we don't know. There's a lot we do know, of course, and we should communicate that with certainty. But there's a lot we don't know, and we've got to keep working away at generating more knowledge so we can fight this pandemic more effectively.
Yeah, and people have to listen. People have to actually follow what's happening and be across the news and these developments and be aware of the world around them as well. Dr. Jha, good to see you. Thank you for being with us.
Thank you.